My oldest son is 4. He's hearing. My daughter is 20 months now. She's hard of hearing. The baby is soon to be 3 months old. We don't know if she's definitely hearing at this point. No, when Aaron and I got married, we had hoped to have deaf kids, hard of hearing kids, whatever. I mean, whatever God given us, we take it. If it's hearing, well, like Ethan, we were happy. The baby was healthy. But just something about having deaf children is just really, it's a joy. My mother's hard of hearing, and she doesn't even care if the babies are deaf or hearing or not. She has grandchildren. That's enough for her.
We did just recently move to Charlotte, probably about 9 months ago, and I mean, we're from Texas, so it was a long, far, move for us, and our biggest benefit was our church family. They are our whole world here. They've been able to help us, where it's a speech therapist, where the doctors, because it is important for us to know that they are going to support our decision.
Last time she was here, we did a repeat screening, okay? She did not pass in the hospital. And your last visit, we found that she looked normal on her screening in one ear, and that she looked like she may have a possibility of hearing loss in the other ear. And with your strong family history of hearing loss, we wanted to quickly identify whether it was present or not.
When we first tested Ariana in the hospital and she passed, it was okay. Later we decided we better take her back. So we had her tested again, and she failed. Terrible word for it. She didn't pass her test. Anyways, A+ on my book. Anyways, Ariana, we're waiting for her test results to come back, and I'm kind of hoping she is hard of hearing, because her sister is hard of hearing, and I think it'd be just wonderful to have the deaf sisters, and they can grow up together and have the same language together, and even if she's not, they will still have the language together. But I think it'd be very nice.
To make a family feel at home with where they're coming from, I think a big part of making them feel safe and they can trust you is talking and listening. Test results are important. That's how we make a lot of important decisions on management. But look at the family interactions, look at their perspectives.
That's definitely a concern for my husband and me, is that, once I start talking about hearing aids and they want to add different technology, it's okay. It's okay if we use it, but at the same time, that's not our focus. Our focus is her learning language, and American Sign Language is just fine. She doesn't need anything else, to make her normal. She's normal just the way she is.
Some families are sort of fearful of sign language. I've had some parents say to me, well, will they become dependent on that? And as you know, that's not the case. So, each family has to make their own decisions and decide which method they want to go with. And that's why it's so important that families are referred to resources and helping them make their own decisions without bias. And the different professionals they're working with don't always necessarily have a full grasp on the hearing loss part. And I need to make sure that I'm doing my job, plus making sure that if they're going out someplace else, that they're looped back in and they've gotten what they need. And that way I know with the parents, was that a good working relationship with you? Or, do you need something else? What questions do you have about her test today?
I've learned a lot.
Good.
I didn't know what all those squiggly lines meant.
Because, of course, Katie's family is not a typical family.
Right.
Most of the time when I first start working with the family, they are terrified that their child is going to have problems all of their life. There's going to be horrible things, and they're grieving. They're grieving with the news.
Yeah.
But you guys, of course, are like, hey, she's
I
cool.
completely understand other parents, but, we've already lived it, and we know, so we're going from there.
Right.
I grew up hearing, and then I didn't find out that I was hard of hearing until I was 10. It just seemed that it was a progressive loss. I didn't learn to sign until I was in college. And when I went into college, it was like my whole world just opened up all of a sudden. I got to learn language. I could understand people for the first time in my life. I had friends, I had fun, I had a normal college experience.
My father's deaf. My mother's hard of hearing. I grew up in the deaf culture. I've worn hearing aids since I was 5. My first language is ASL. I learned to speak later on. One of the gripes that I have is that people are saying that it's a picture language, and it's not. It is a very complex language with its own nuances, its own vocabulary, its own grammatical structure that conveys so much information. And it's very, very, very natural, really, for a deaf person to start signing.
We've had two people that came. Catherine, our early intervention person, came first, and she's been focusing on the sign language part of it, and that was per our request. And has been fantastic at it, done a wonderful job, and Katie has just grown so much in her language because of that once a week. I mean, she just learns so much. The second person, we asked them because we thought that maybe once a week was not enough. And she started coming, but her focus was more on learning speaking, which of course right now was not really our interest. So after a few months, we decided to go ahead and drop that part of it.
We as early interventionists are in contact with the physicians and the audiologists, and we're trying to explain what does the audiogram mean, what does hearing loss mean, what are your choices that you have, and Aaron and David had already made up their mind what their choices were, so it's just up to me to support them in their decisions.
She's teaching me, learning methods, how to teach it to her. I know the signs, but, I've never had to teach anybody, so she's helping me a lot with that. I guess if I go into a doctor's office, the first thing I would want is, of course, for the people to respect enough to look at us and really work with us. That would be the most important, the reason why I would want to go back, if they are willing to communicate with us. I really like this doctor. She had tried to make us comfortable. She helps some with the referral. The insurance is so hard to match a good doctor with, and we've been fortunate to find one.
That's what we're here for, is to provide the best medical care and provide a medical home for patients who need it, regardless of what their insurance status is. I don't even look at what it is other than who I need to call to get something done. I'm a real bulldog when it comes to making something happen for a patient. Hi! Feeling better? Bambi! Ooh. Show me. If I have a parent who tells me this is what's best for my child, you've got to listen to that. You need to present to them what their options are. And a lot of times they've done the research and they come and tell me this is what I want. And it's kind of like, well, let me see what if I can't make it happen. I know that everyone has a different way of approaching the hearing loss. And every family, has their own choices to make. And, my role here is just to support you, and, down the line is best for her, we'll just address that as we need to. Okay. With the O'Donnell family, I very much am looking forward to learning more about the deaf community and look forward to dealing with whatever issues come up with them. But I don't look at them as, deaf children, I just look at them as children.
There's just so many people involved. There's a speech therapist, there's the intervention, there's the audiologist, there's the doctor, the advocacy corporation, everything. And all of those people working together is what makes our medical home work.
The important thing is that she's communicating with us, that we know what she feels, her thoughts, her needs, her goals, her dreams, that we know. And that's so important, is communicating with her and with Ethan and with Ariana.